Hello, and welcome to this episode of NeuroRestorative Radio. My name is Tommy Treadway, and I'll be your host. I have Dr. Victoria Harding joining me today to discuss how specialized after-hospital, community-based brain injury rehabilitation differs from nursing home care. Dr. Harding is the Vice President of Development at NeuroRestorative and has over 2 decades of experience as a clinician and operations leader in brain injury rehabilitation and has worked in this capacity for several national companies, providing community-integrated and independent living programs in various rehabilitation settings. Welcome, Dr. Harding. Please tell us some of the key differences between specialized after-hospital, community-based brain injury rehabilitation and nursing home care.
Well, sure thing, Tommy. I'm delighted to have the opportunity to talk about this important difference. I'd start by indicating that the focus in these two different levels of care is entirely different. Specialized after-hospital community-based brain injury rehabilitation programs focus on increasing safety and independence and quality of life. These programs are entirely outcomes-oriented in that the goal is to make a measurable change from an individual's level of function at admission to the time that they discharge. Whereas a skilled nursing facility or nursing home care, the focus is on medical care, and it may include periodic therapies, but is really maintenance-oriented. It's designed to try and keep an individual's level of function from slipping, from not getting any worse, and does not have a rehabilitation or improvement focus. Tommy, I think the big difference is really the environments of care that NeuroRestorative creates to well serve an individual and their family recovering from brain injury. These environments are not contrived in that it's not a pretend store that individuals visit. It's not a pretend home that they're learning how to bake a cake in. It's a real home in a real community environment and context. So those very skills that someone is going to need to be successful back in their home community are practiced every day as often as possible with guided supports and services to ensure correct practice. This is really the fundamental difference between a community-based rehabilitation program where the focus is on gaining those skills that are needed and an institutionalized level of care where an individual may receive therapies or supports periodically throughout their day, but not within that context where they're really going to use those supports, use those skills throughout their opportunity to learn.
And are there differences in the staffing levels between the two types of facilities?
It's a great question, Tommy. Certainly, we see in the skilled nursing facilities that it is typical to look at a staffing level of about 1 staff member to 10 different individuals. In the specialized after-hospital community-based brain injury neurorehabilitation programs like NeuroRestorative, we see that the lowest level of staffing is typically 1 staff member to 3 individuals served. For individuals that have a higher need of support, we oftentimes see that there is a 1-to-1 level of staffing. And that is direct care staff, our life skills trainers, and does not include our clinical staff such as occupational therapists, physical therapists, speech-language pathologists, and neuropsychologists, or nurses or case management. This staffing level is important because we want to ensure that there are staff who can be with the individual we serve to ensure that they're generalizing those skills that they are learning in a highly structured environment for maximum practice of skill during an individual's day. In a skilled nursing facility, you may see that individuals leave their room to receive therapy in a gym or an office for 30 minutes or an hour for a number of visits per week. In a specialized after-hospital community-based neurorehabilitation program, the goal is really to have someone practice those skills the maximum number of times throughout the day. So instead of doing a skill they're trying to achieve 10 times or 20 times a day, they have an opportunity to practice that correctly 200 times a day. These are the environments of care that we create so that people can practice those skills as much as possible and get back to normal functioning and back home as quickly as possible.
What about differences in staff training?
All staff at NeuroRestorative are certified in professional crisis management, and many are certified brain injury specialists. All of our staff complete competency-based training together with their medical requirements. In a skilled nursing facility, we see that staff training may not be specialized and that there is no specialized certification beyond basic medical assistance training, such as that required to be a CNA or first aid or complete CPR.
Can you talk a little bit about differences in licensing and accreditation?
We're delighted that NeuroRestorative has achieved the highest level of CARF accreditation as a brain injury specialty program. The Commission on the Accreditation of Rehabilitation Facilities has found that NeuroRestorative meets the criteria for 3-year accreditation. Skilled nursing facilities are not CARF accredited and have no demonstration of commitment to specialized quality improvement to serve individuals who have sustained brain injury. Every NeuroRestorative program is also licensed by the state in which we operate and is recognized as a provider of brain injury rehabilitation. In this way, we're ensuring that we are providing individualized, person-centered models of care to increase community rehabilitation. We're part of a continuum that safely improves independence and is designed to reduce supports and services over time. A skilled nursing facility does not offer a continuum. Individuals are typically expected to remain institutionalized for life. The emphasis is not on community integration, and these programs are licensed by states as nursing facilities or as skilled nursing facilities.
To wrap up, can you tell us some of the differences in family involvement between the two types of facilities?
Sure. In the specialized after-hospital community-based brain injury neurorehabilitation programs, we see that direct family training is essential. We want to ensure that families are a part of our therapies, are learning the techniques that are going to best support an individual when they return home with that family. The CARF accreditation, the Commission on the Accreditation of Rehabilitation Facilities, ensures that this is a big part of certification, of ensuring that our programs are inclusive of families. Whereas in a skilled nursing facility, we see that family training is optional.
Thank you, Dr. Harding, and thanks everyone for joining us today on NeuroRestorative Radio. For more information about NeuroRestorative, please visit us at NeuroRestorative.com and consider signing up for our Neuro Institute, which offers free 1-hour online CEU opportunities every month. You can find more information about Neuro Institute at NeuroRestorative.com/institute. Until next time, thanks for joining us.